Hello everyone and welcome to our YouTube channel. Today, we'll delve into how female hormones like estrogen and progesterone play a significant role in shaping emotional and social intelligence. Emotional intelligence refers to the ability to perceive, understand, manage, and regulate emotions, while social intelligence involves the capacity to navigate and maintain relationships effectively. These hormonal influences can vary across different phases of life, including menstrual cycles and menopause. Let's discuss the impact of female hormones on emotional and social intelligence. First one is estrogen hormone. Estrogen enhances emotional sensitivity, empathy, and social bonding by increasing the activity of neurotransmitters like serotonin, dopamine, and oxytocin. These chemicals contribute to feelings of happiness, connection, and trust. Estrogen supports verbal fluency, memory, and decision-making, which are critical for effective communication and social interaction. Second one is progesterone hormone. Progesterone has a calming effect by modulating gamma-aminobutyric acid, a neurotransmitter associated with relaxation. However, high levels of progesterone can also contribute to emotional sensitivity, mood swings, and withdrawal from social activities. What are the effects of menstrual cycle phases? The menstrual cycle is divided into phases, each marked by fluctuating hormone levels that influence mood and behavior. First, follicular phase. From day 1 to day 14, estrogen levels rise, enhancing energy, optimism, and social engagement. Women may feel more confident and communicative during this phase. Increased emotional sensitivity and reduced stress responses facilitate positive social interaction. Second, ovulation phase occurs around day 14. Estrogen and luteinizing hormone surge, boosting libido, attractiveness, and social confidence. Women may display heightened empathy and emotional connection, beneficial for building relationships. Third, luteal phase. From day 15 to day 28, progesterone dominates, and estrogen levels drop. Women may experience mood swings, irritability, or social withdrawal due to premenstrual syndrome. While some women may struggle with negative emotions, others may experience increased introspection and emotional depth. Fourth, menstruation phase. From day 1 to day 7, estrogen and progesterone are at their lowest levels, which can lead to fatigue, low mood, or irritability. Social interactions might feel less rewarding during this phase. Now let's discuss the effects of menopause. Menopause, marked by a decline in estrogen and progesterone, introduces long-term changes in emotional and social functioning. First effect is emotional challenges. Reduced estrogen levels can lead to anxiety, depression, and irritability, often linked to diminished serotonin production. Memory lapses and difficulty concentrating may affect social communication and emotional decision-making. Second is social intelligence. Lower oxytocin levels may lead to decreased feelings of social bonding and trust. Many women develop coping strategies such as mindfulness or social support to mitigate these effects and maintain emotional intelligence. Third is potential benefits. Despite hormonal changes, older women often draw on life experiences to maintain or enhance social intelligence. Emotional resilience and perspective-taking may improve, compensating for biological changes. Female hormones greatly affect emotional and social intelligence, impacting mood, empathy, and thinking skill. Menstrual cycles cause temporary changes, while menopause brings lasting effects. Next is how to minimize and manage the negative impact of female hormones. The impact of female hormones on emotional and social intelligence can be managed and minimized through a combination of self-awareness, lifestyle modifications, and targeted strategies. Hormones like estrogen, progesterone, and cortisol can influence emotions, decision-making, and social interactions, particularly during phases like PMS, pregnancy, or menopause. Here's how to address this. First, self-awareness and monitoring. Use apps or journals to track menstrual cycles and identify patterns in mood and behavior. Knowing when hormonal fluctuations occur can help you anticipate and prepare for potential emotional changes. Reflect on situations or thoughts that exacerbate negative emotions. Second, lifestyle adjustments. Incorporate foods that stabilize blood sugar levels, such as whole grains, lean proteins, and healthy fat. Include magnesium-rich foods, nuts, seeds, spinach to reduce PMS symptoms. Avoid excessive caffeine, sugar, and alcohol, which can exacerbate mood swings. Engage in regular physical activity to balance hormones, improve mood, and enhance social confidence. Activities like yoga and Pilates also promote relaxation and emotional control. Aim for consistent quality sleep. Poor sleep exacerbates the effects of hormonal fluctuations on mood and cognition. Third, stress management techniques. Practicing mindfulness can help improve emotional regulation during hormonal shifts. Deep, rhythmic breathing reduces cortisol levels and promotes calmness. Cognitive behavioral therapy can help address emotional responses and improve resilience to hormonal fluctuations. Fourth, support for social intelligence. When feeling emotionally reactive, pause before responding in social situations. Practice active listening and focus on others' perspectives, even when feeling irritable or overwhelmed. Let trusted colleagues, friends, or family members know about your challenges during certain hormonal phases. Fifth, medical and supplementary support. Omega-3 fatty acids can reduce inflammation and mood swings. Vitamin B6 and evening primrose oil may help manage PMS-related emotional symptoms. For severe emotional disturbances, discuss hormonal therapies or medications with a doctor. Check for imbalances like low progesterone or high cortisol levels, which may require medical intervention. Sixth, focus on emotional intelligence skills. Recognize when hormones may influence your mood and employ grounding techniques like journaling or affirmations. Build strong support networks with people who understand and accept your fluctuations. Attend workshops or read books about managing emotional intelligence to reinforce skills during challenging hormonal periods. Seventh, long-term strategies. Manage social obligations to reduce overwhelm during hormonally sensitive periods. Engage in activities that build resilience and self-esteem, such as hobbies or professional development. By combining self-care, mindfulness, and professional support, it's possible to minimize the impact of hormonal fluctuations on emotional and social intelligence, fostering better relationships and emotional well-being. How does pregnancy and childbirth hormonal changes affect her emotional and social intelligence? Peripartum hormonal changes in women, spanning pregnancy, childbirth, and the postpartum period, can have profound effects. These changes are mediated by fluctuations in hormones like estrogen, progesterone, oxytocin, cortisol, and prolactin, which influence mood, behavior, and cognitive function. Here's how they can impact emotional and social intelligence. First one is heightened emotional sensitivity. Estrogen and progesterone levels fluctuate significantly during pregnancy and postpartum, influencing brain regions associated with emotional regulation, such as the amygdala and prefrontal cortex. Women may experience increased emotional sensitivity, which can enhance empathy and emotional awareness. Increased emotional awareness can help women better read social cues, but hormonal imbalances may also make them feel overwhelmed in social interactions. Second one is bonding and empathy, often called the love hormone. Oxytocin surges during childbirth and breastfeeding, promoting bonding between mother and child. Mothers often report stronger empathy, particularly towards their infant. This heightened focus on the infant can temporarily narrow attention towards other social relationships, potentially causing strain with partners or friends. Third one is mood stability and regulation challenges. Increased cortisol levels during pregnancy support energy demands, but may lead to stress and anxiety. Postpartum drops in progesterone, a hormone with calming effects, can contribute to mood instability. Emotional regulation may become more challenging, affecting a woman's ability to manage stress or respond calmly in emotionally charged situations. Fourth one is cognitive shifts such as mommy brain. Fluctuations in estrogen and cortisol during the peripartum period can temporarily affect memory, attention, and executive functioning. These changes may make it harder for women to process complex emotional information or maintain focus in social interactions. Fifth one is risk of mood disorders. Hormonal shifts, especially drops in estrogen and progesterone after delivery, can contribute to postpartum depression or anxiety. Depression can impair self-awareness, self-regulation, and motivation. Social withdrawal, irritability, or feelings of inadequacy can hinder the ability to build or maintain relationships. Sixth one is resilience and growth. Despite challenges, hormonal changes can also promote personal growth. Oxytocin fosters caregiving behaviors, while mild stress may build resilience. Many women report increased emotional maturity and stronger social bonds over time as they adapt to motherhood and navigate its demand. While peripartum hormonal changes may temporarily challenge emotional and social intelligence due to mood instability, cognitive shifts, and stress, they also create opportunities for growth in empathy. With adequate support and self-care, most women adapt successfully, often emerging with enhanced emotional and social skills, particularly in caregiving context. Please like the video, subscribe to the channel, and share it with others to spread awareness about how female hormones play a significant role in shaping emotional and social intelligence.